My silent partner for this research project is a young 75-year-old woman that is a dedicated customer of Jazzercise for the past 8 years. She attends regularly and loves the workout, the music, and the hip moves. She said it makes her feel young again. And she also loves the camaraderie of the other women in class. It's ritual. They all come early and stand around and chat it up before class starts. Always interesting gossip. This past October, she told me that she was diagnosed with breast cancer, which was detected from 3D mammography imaging. She never felt a lump in her breast. The tumor was the size of a piece of pea gravel. Mastectomy surgery was scheduled. She said she was only planning to be out for a minimum amount of time so she could return back to Jazzercise. Prior to her surgery, I consented with her to be a partner for my research project in an effort to enhance her chemotherapy treatment with herbal medicinals and to hopefully get her back on her feet, feeling good, and back to Jazzercise. She was open to the idea and was interested to try something natural to minimize the chemotherapy side effects and offer strengthening benefits. She had a seamless recovery from surgery. She returned to Jazzercise after the new year feeling great, but the chemotherapy treatments were about to begin. At this time, we both agreed to err on the side of caution, since her oncologist was not privy to her participation in this trial, and decided to wait to offer the herbal supplements until the last couple of chemo treatments. She started out strong, but by the third treatment, she lost all of her hair and was beginning to feel the ill effects to chemo. She felt weak, tired, bloated, and her skin became very itchy and sensitive. She continued to come to class, but had to cut back on the frequency and intensity. I designed an herbal treatment to boost her immune system with immune-modulating herbs, astragalus and reishi, along with ashwagandha to sustain her energy levels and stamina. I added licorice to synergistically enhance the other herbal properties. The supplemental herb, goji berry, is high in antioxidants and a superfood in repairing oxidative stress. Treating the adverse effects of chemotherapy can be challenging. This recipe helps to protect the body from further disease and gently repair and rejuvenate internal systems that have been compromised from chemotherapy. The importance of stimulating the immune system when the body is being stressed by chemotherapy is critical for revitalizing bodily functions and boost the body's natural healing properties. She's been taking the immune-boosting herbal balls for the past 4 weeks. Her chemo treatments are finished, and she's beginning to feel stronger and more focused without any foreseen ramifications. She said she's not completely sure if it's the herbal balls of why she's feeling a boost in energy or that she's simply healing. Either way, I'll take this as a positive outcome. She was happy to comply with the suggested treatment plan of eating 4 balls per day. It certainly helped that the treatment was pre-made for her, so there was no real work involved. She described the taste as not bad, kind of like a healthy protein bar. Not great, but not horrible. Drinking water and following up with something salty helped the herb aftertaste. Interaction of herbs with chemotherapy is an important topic of controversy. According to theoretical possibility, there's a strong potential for herb-drug interaction while administering herbs together with chemotherapy. Research from Biswell et al. In 2013 studied the effects of ashwagandha and chemotherapy fatigue and quality of life in breast cancer patients and did not encounter any loss of effectiveness of chemotherapy during treatment. They deemed ashwagandha to be safe for treatment of cancer patients during chemotherapy. Reishi was also studied by Gao et al. In 2003 on the effects of reishi on the immune functions in advanced stage cancer patients. It was indicated that the combination of chemotherapy with immune-modulating agents such as reishi may provide a strategy for overcoming the immunosuppressive effects of chemotherapy. Block and Mead performed a review study in 2003 on the immune system effects of astragalus, echinacea, and ginseng and integrative cancer therapies. Studies indicated some relevance for use in restoring the immune suppression commonly seen in cancer patients. However, it would have to be taken with the understanding that minimal scientific evidence supports it. Boone and Wong reviewed botanical medicine and cancer in 2004. Preliminary evidence suggests that some herbs may have a role in preventing cancer or as adjunct therapies for its treatment. The herbs reviewed generally had no significant adverse effects and did not appear to be likely to interact negatively with conventional treatments. However, it is their expert opinion that clinicians should continue to recommend against the use of herbs during chemotherapy treatments until more definitive evidence of safety is available. While studying the Materia Medica and the many benefits of the herbs I chose, combined with a long history of TCM and Ayurvedic herbs, I've learned that there is minimal clinical trials and evidence to support these herbs, with most trials supporting further clinical research. My partner has continued to experience a positive outcome from taking the treatment, but what really worked was the trust factor. She has a disease that is the #1 cancer killing women today, with horrible side effects from chemotherapy, and often makes women afraid to let the world know. But my partner trusted me. She was comfortable talking to me about her treatment and experience. Ask a cancer patient what his or her chemotherapy experience was like, and you'll quickly find that, like any other part of the cancer journey, everybody's story is different, and most people are hesitant in wanting to share. She was open-minded to try something new. I am forever grateful to learn from her strength. My recommendation would be to communicate with her oncologist and to inform them of the herbal treatment trial to identify and minimize the risk of any potential interaction. Having an open dialogue between patient and practitioner is important to assess and determine the capacity for detrimental chemotherapy and herb interactions. The research conducted by McCune et al. In 2004 found herbal use in patients receiving chemotherapy was common, actually 78%. And although most patients discussed herbal use with their oncologist, the majority relied on their friends and naturopathic physicians for herbal information. Considerable potential exists for herb use and chemotherapy treatment, but more research and clinical trials need to be performed for more solid evidence for conventional physicians to get on board.